Good evening, everyone. I am your Mike Asherbrander, the proud and humble and tired leader of the Hounds of Business community, and I am here with my good buddy and special guest, Rochelle Proser, right? No, Prosser. Say it
Prosser.
right for the people.
Well, Prosser. Hello,
See, I
everyone.
only know. I only said it 800 times, And look, Jamie, see, I was going to say it, but I'm going to mess it up. Now I'm overthinking it. Look at her back there. She's not going to, if she doesn't leave backstage, man, I will be so
Mhm.
proud. So, how are you today? So, give everybody an update. You travel around like Waldo, everywhere, man. So, what have you been up to here lately? Because you're doing a lot of great things. Fill us in, please.
So I recently went to the Advanced Precision Medicine Conference in Philadelphia to talk about the importance of having dedicated and targeted cancer remedies and looking at reformatting how we perceive the image of how cancer treatment is given, looking at workflows and extenuating them and making them more streamlined so that we can remove the pain points that actually stop and clog the wheel for patients getting faster treatment and getting to the diagnosis and then on treatment sooner. So that was an excellent conference and really learned a lot. And they actually had me on stage talking about women's health. So that was wonderful.
Yeah, you're welcome. I had to block somebody. Somebody spamming me already. All right. So, yeah, no. So that means that people survivor rates probabilities increase, right? Like
Yes.
everything's better, and that's what you've been working on. We're going to talk about that in a little bit, because you
Mhm.
brought some special guests, and I can't wait to get with them. So, hey, it's funny too. I'm glad. I don't care if we're not going into politics, but I ain't the only person on this planet glad it's over with. Like I'm ready to go on
Oh,
to Thanksgiving
cool.
and Christmas. You got it.
Yeah.
I'll tell
Hmm.
you what. I don't leave the house. This is funny to me. So basically, I ended up leaving. All right, so I got this. And I basically grabbed it off the table and went, I earned it because I spent 2 hours. 2 hours. I had to sign oaths. I had to sign giant books. The
Hmm.
computers wasn't working. I was like, man, and I was like, I was dedicated because I was hungry, but I was already there for an hour. So it's too late to go home because now you feel like you didn't get anything done. So that's what I did. So I'm so glad it's over with. I was done. And then there was a crazy veteran that was helping me with, yeah, he was like, I'm
There
gonna
you
break
go.
this thing. I was like, you can break it because they won't put you in jail. They'll put me in jail. I ain't breaking. I'm gonna leave. But
They had
yeah,
you
he was
singing
good.
like they had you singing like Christmas, hey Mike?
Yeah, see, I'm library tough. I'm not jail tough. See, I'm like monastery tough. I'm not. Yeah, I know where to go. I could be the toughest guy in the kindergarten, but I'm not. I ain't trying to go to jail. No, I know better. All right,
No,
so we got
no.
all the good people up there. Um, Jamie Racebrook is giving me stuff in the backstage. So I'm feeling better now. I'm feeling good about life. How y'all doing? In the comments, hey, audience hounds, thank you for showing up. Have a good time. Uh, Rochelle, tell folks what we're doing today. Tell
So
folks eloquently like you put it earlier.
yes. So today we're talking about health equity and Lung Cancer Health Equity Summit that has been created by Dr. Eugene Manley, and that will be in Atlanta or North Atlanta on November 18th and 19th. And we wanted to bring this event to the Hounds of Business and also bring in the veterans community because we're talking specifically about lung cancer. And lung cancer isn't just about smoking. You can have environmental exposures. A lot of our veteran community have been exposed to burn pits or in active duty areas that and chemicals that they need care. And so the Biden administration has really stepped up and put the cancer veterans cancer panel together and provided extended benefits that we just wanted to bring awareness to the veteran community and invite them to the space if they are in Georgia and in the Atlanta area to come out. We will have Veterans Administration right there on site to help them activate their benefits, fill in paperwork, and help them get the treatment in the ways and manner that they need. So we brought on these wonderful individuals, Dr. Eugene Manley and Dr. Jamie Rashbrook, who is the women's veteran advocate. She is fabulous and she is amazing. She focuses on women being more vocal, women veterans being more vocal about their health, about their needs, and about their cares, both in active duty and in the veteran community. So I'm so excited to have them to here today, and just to hear what they have for us, the veterans community, and anyone in cancer today.
Oh my goodness. See, I'm so happy that I'm gonna let you host and I'm gonna go read a book because you got this. But I'll chime in with some silliness every now and then because that's some people like that. So, but no, Jamie, yeah, y'all said, hey, who can we share this with? Because Jamie, she has been a very strong proponent and advocate for all veterans. And
Mhm,
here lately, very much for women veterans and really helping them in all areas. But she
mhm,
is very familiar with the healthcare challenges and navigation, issues that folks face. So this is going to be a really good, fun chat. I want you all to really learn about these folks, tap in, share, and plug in and support these people because these are folks who just got sick and tired of being sick and tired about things
amen.
happening around them and
That's
seeing
right.
people. And it's like Jamie, right? Like, hey, somebody's got to do something about it. And that's
Yep.
what all these folks today are. So I'll tell you what, we have a packed house already. So glad to see you guys. Give a quick shout out before we run the video. We got LinkedIn user, always good. You got me hitting buttons back here when I shouldn't be. Oh, I just messed the whole show up. All right. Oh my gosh, it did. Help. All right. Well, let's see.
You got this,
See what I
Mike.
have. You think Tommy, big Tommy's here. Royce, thank you so much. Uh, Alyssa, so nice to see you. She was on my group call. She's coming. She's coming. Don't tell her. She's coming to that.
Yes, and Kristen
Jason,
Bell's here, and Homer, and
yeah, home and Jason Perry. He's
and
more
Tom.
country than I am.
Yes, I see Alyssa Wallace here, and David Anson. So nice to meet you all. Thank you for coming.
Absolutely. Well, you're a wonderful host, a co-host there, Rochelle. Well, let's go ahead and roll the outro. And I've got a couple people we want to track. All right, so we got so many amazing things in the hounds of
Mhm,
business. People doing amazing stuff, guys.
mhm,
So hey, quick infomercial. All right, don't do it. People have an impact to make in this world, and they usually won't because they don't have the
mhm,
resources and support to get there. All right, we
mhm,
do things without the pitch slapping with a P, spamming people. Instead of worrying about what you want, go out there and help these rock stars like we have on this panel in these comments. Go help them get what they want. And guess what? You'll get more than what you could get by yourself because they reciprocate. All right. This is what it's about. I love it. All right. So we'll roll the intro and we'll get this party started.
Are you looking to grow your network and your net worth with other high-level, heart-centered professionals? Then grab a seat and your favorite beverage and join Mike Asherbranner, the Redneck Connector. It's time for the Hounds of Business Community Happy Hour.
All right. We won't take a lot of time, but we have a good friend of ours, Kevin Smith, that Dr. New had introduced us to. And this guy, if you hadn't heard the story, you got to go to the website. You got to check it out. We on Hounds of Business on YouTube. Search that.
mhm,
It is guy has built humble guy built a huge financial business, lost his wallet, and now he is running around spreading kindness literally across the world. It is absolutely wildest story. It's unbelievable. And so we're gonna play like remember where in the world's Carmen San Diego and stuff. That's exactly what I was like. Well, where in the world's Kevin today? Now you never know. He's in Lithuania.
mhm,
He's with the UN. And so Kindness Week, guys, is coming up. So he's going to be in York, Pennsylvania,
mhm,
and everybody tap into this. Is a fun but meaningful movement, man. There's so much negative and challenges and going on, and we forget just the simplest act of kindness can go a very long way. So being
mhm,
around Kevin and his smiley self, man, always reminds us. So this guy, I just, it's a fascinating story. All right, and it's what happens when you put yourself in the right ecosystem and the right mindset, and continuously just look for opportunities. Because there's no way this man could have planned what he's doing, And so everybody, do me a favor: scan the QR code, go to kindnessworldwide.org, kindnessworldwide.org, plug in, share, and just spread it. Right? Don't take any money or anything. Just spread it. Share it on the post. Do whatever you
mhm.
can to get behind this movement because it's easy to get grumpy when you build a business and working and driving around like Rochelle is all day long, right? us.
I know that's right. I know that's
So
right.
we want to make sure we give him a shout out kindness week. All right, November 9th. There's lots of plans. We'll
Mhm.
be unveiling that. So check our YouTube and also check our LinkedIn. And if you're in the house, we'll be putting that in our community post so you guys can plug in. And thank you for the
Yep.
support. You all are amazing with this. Nobody backs each other up like you guys do, I tell you. All right. And this is a friend of
Absolutely.
ours. Would you like to introduce this? Because I got to meet her. Go ahead.
Absolutely. And I'm going back to the other one. I don't know anyone who has not left their purse or their wallet somewhere and wish and prayed that they got it all back intact. And that's happened to me. It's actually happened to my husband. And the person called me at home to bring it. And my husband had no idea. He was gone up to Jacksonville, and we had his wallet. So these things happen, these random acts of kindness. And I really encourage you to go ahead, scan it, hear what he's about, and join the
Oh, it's
cause.
amazing.
So
When I
let's go
lose
on to
my
the
wallet, I scream
next.
obscenities, right? But this guy, no, not him, right? Somebody returned it and then he went to try to find her. It's just amazing. It sounds like fiction, but it's not. It's
Yes,
amazing. So we're on that.
it's not.
And then our
No,
friend that I met through you and Amber
this
Williams,
is Jill's.
Jill Squire, right? So
Mm-hmm.
you
Fire,
you are
yes.
like cookies and milk.
She's amazing. Yes, we are. I've known Jill for a few years now, and she is an amazing oncology nurse navigator that has transitioned away from the bedside and just got tired of being sick and tired of patients not being cared for the way that they need to, like I kind of did. But instead of going to health policy, like I did, she started a podcast called the Everything Cancer Podcast. I kind of feel like that's that Japanese karate movie where it's at here, there, everything all at once, all at one time. But I'm telling you, you will listen to this and go away with something amazing and special. And not only does she have that, she actually has a book that helps cancer survivors and during and through their cancer treatment into survivorship to log and track what's happening to them to ensure that they're addressing their concerns with their healthcare provider, but making sure on top of that to log and catalog so that if they relapse, they have a wealth of a dictionary and a library that they can go back to and share their feelings and help address their mental health issues in a safe space that actually will guide them on their journey in cancer survivorship.
Yeah.
So this is Jill Squire. She's amazing. Everyone just go to the QR code, join what she has, and get the book.
And I've
Absolutely.
heard people come to me right when I met her, and they're like, "Oh, she wrote the book on pretty much cancer survivorship," and I'm like, "Wow, that they don't say that lightly, right? People don't say that stuff; they don't mean it in this wheelhouse." So, because she
Mhm.
really is, she's a cancer hub. So if you're going through it or someone you're going through it, scan
Yes.
that QR code, check out her website. We'll be unveiling more, and she
Mhm.
is revising the book, so we'll make sure that everybody gets that revision
Yes.
out because it has really changed lives. So, man, amazing things. And
Yes.
then
Mhm.
you, you. Yeah.
Yay. Oh. Shameless plug. So this is Orchid Healthcare Solutions. That is the my company. And I did it because I was the parent and the spouse of two cancer survivors who were diagnosed within a month of each other. One was 3, one was 52. I can't imagine going through that alone. But here I was trying to navigate my career while still taking care of my family and working. And so I wanted to find what was the best way to help others out of this. And for those that are going to ask, they are alive. She's 14. My husband and I are still married. We're going strong. But it's a beautiful story. But what could I do out of that to help others? And so we created a cancer treatment library that houses all cancer therapeutics in one place. And we remove the barriers that patients find in third and fourth stage and later stage metastatic disease to offer options. I'm not going to say it's a cure, but at least you can have a conversation with your physician about what comes next. when you've exhausted treatment in your facility or under their advisement. The most important thing is to be able to communicate better with each other, with your healthcare provider, and say in the way and manner that you want to do. So the other thing is, I'm a nurse. I'm a neurotrauma ICU nurse and ER nurse. So what better vehicle than to create a nursing EHR? Because the patients are the closest to the nurses. When you're in trouble, the first person you pick up the phone and call is your nurse. But what we're finding that we can't address their quality of life. And so we make that data available so that you can have that action, as well as house all your medical records and imaging in one place. And that includes your pathology reports, because that can change over time. But if you did it in one hospital, it's not transferable elsewhere. And so patients need that healthcare navigation services. And we help with the decision support system that you have between your provider and you, to make sure that you get the care in the way and the manner and the means that you want to do. So that's Orchid Health Solutions.
Let me put this in layman's terms. If you're on the patient side and cancer care or the medical, you can help everybody, right?
Correct.
There you go. And you're doing it. So, hey, we're not going to spill the beans. Much more coming. Big announcements, good things happening. Stay posted, all right? And
Yes.
so I'll be posting about that. So I tell you what, let's bring these amazing folks up and let me watch this.
Yes, can't wait to see them. Hello.
Good evening, Jamie Raichbrook. See that? I got a speak and spell, and I figured it out. Dadgummit. So how are you today?
I guess I should turn on my mic before I start laughing at you, right?
Yeah.
He's only known me a couple years. There's no reason why he shouldn't be messing up my name still, but okay.
Right. I mess up.
I'll just spell it out.
Rochelle.
It's almost army proof, but it's okay.
Yeah.
Exactly. So thank you for coming. I know you got a lot
Thanks
going
for
on
having
today.
me.
Oh, always.
Here.
She said veterans. I was like, well, Jamie, duh. All right. So, and then we got Eugene, Dr. Eugene Manley. Good to see you, my friend. And I met you through Rochelle. How are you doing?
Good evening. I'm good. How are you?
How am I? Oh, man,
Yes.
Crazy as ever, but happy, dude.
There you go. I saw you had an entertaining Halloween.
Did you see my post?
Yes.
Where I fit in everywhere on Halloween. I'm like, wow, I go to church. I go to any party. Everybody's like, wow, this guy's like Joe Dirt. I'm like, no, this is my regular stuff. Like, then on November 1st, I'm the same. They're like, why is he still dressed up like that? I'm going to be me for Halloween. That's the funny joke. All right.
I'm wondering who dressed like you. That's what I'm wondering.
You should have. That's what we should do next time. Yep. I was supposed to dress like
I got in a box.
DJ.
I got it in a box somewhere, I'm sure. Mixture of.
I was going to dress like Dr. Eugene, or I'm not, CJ, Dr. CJ. But the wigs, they were all out of wigs.
Yeah. Did they run out of wigs? I don't even see how that's possible.
Yeah, they were all out of the.
So many.
Yeah. I wanted the purple Rapunzel wig, but anyway, all right. So, Dr. Eugene, look at him. Look at him. He's like, is this for real? Yeah. It is, buddy. You're live, baby.
Welcome to the party.
Yeah. So,
you don't got enough PhDs to back this up.
Yeah, no. Dr. Pepper's
that's a stamp of approval.
I'm still Mr. Pibb. So, Dr. Eugene, tell us what you're all about, what you're doing, because you have an event coming up. So I want you guys, if you don't mind, share people what you do and what events you have coming up, and then we're going to dive into a good discussion about it.
All right. So I run the SCHEQ Foundation, or the STEM and Cancer Health Equity Foundation, which is a nonprofit that I founded broadly to work to increase workforce diversity in STEM fields and to increase outcomes for underserved patients navigating the cancer care continuum. And a lot of this was born out of just my experiences of growing up as a first-gen scholar in the inner city Detroit and seeing how healthcare was and wasn't delivered to my family and others. And then as I navigated academia and just seeing how there's a lot of schools that have programs for diverse scholars, but then they really don't do the wraparound stuff to ensure that you can succeed and excel in your STEM path or whatever path you take. And then the last part is really just the lack of information and resources that get to underserved patients, that's literate, that they can understand, and then how do we help these patients understand this information and eventually get them to advocate for the care they should get versus what they do get. And so as part of that, I'm trained as a mechanical engineer, biomedical engineer, and a cellular molecular biologist, and have done my fair amount of stuff in lung cancer in the lab and in nonprofit space. And I routinely talk to underserved patients, minority patients, and they lamented at the fact that they really don't see themselves reflected in materials. They don't know where to find resources. They don't really see anyone that looks like me that talks to them, especially the community groups. And so I decided that we really needed to start to move the needle and bring more information to these populations, which sort of is part of the reason why we're doing our Lung Cancer Health Equity Summit, which will be at the Philadelphia College of Osteopathic Medicine in Suwanee, Georgia, November 18th and 19th. And the topic and theme for this event is Black and Latino patients navigating lung cancer, stepping stones to equity. So while those are the populations we are focusing on, that does not mean that's the only people we have or are talking to, but really the whole premise for this is that we always talk about problems that these communities face. We talk about problems ad nauseum, but we rarely ever have an event where we bring different stakeholders together from all levels to talk about solutions and interventions that have been implemented or created that are actually reducing disparities, reducing inequities, and or improving outcomes. And so we put together a 2-day summit that's alternating speaker sessions, panel discussions, a couple of keynotes. And we have patients, caregivers, researchers, clinicians, pharma, insurers, government, health hospital systems, and really just trying to cover the whole, well, not everything, but we're trying to cover a wide spectrum of topics. And we have speakers from all over the country. And the whole big requirement for my program was that every session and panel had to have at least one woman and at least one diverse individual, because it's very hard to say you're doing health equity if all your sessions are 6 homogenous individuals. Their leaders are all homogenous. So we made sure to have those speakers and for people to say, oh, well, how do you find those? If that's your first question, then you're not ready to do the work.
Yeah, let me say this, Dr. Eugene, you're taking on all of this. You're helping those who can't help themselves, man. That's what I heard. And you're doing this, and I see what happens behind the curtain. Just like Jamie, just like Rochelle. I want everybody out there to know, and thank you for coming out to support, man. I can't even keep up with the comments. Hounds, you're the best. Friends of the Hounds, thank you. You could be doing a lot of stuff. You could be out there just making a bunch of money and doing all this other stuff, but you're grinding because you truly care about the folks who can't help themselves, and you're going to make a daggum difference. That's why you're here, man. That's why we cannot be more grateful and excited to be able to promote you and help you get that word out, right? And which leads me to Jamie Racebrook, who is a good friend, and I can finally say her name. So thank you so much. And I'm gonna toot your own horn. You're gonna get red like a tomato. That's okay. I'm telling you, grind. When you come up from challenges, right? You have dirt and you don't have a lot of advantages. It's a grind. It's hard to build a business. It's insane. You go through sacrifices galore. And I watch her day after day, year after year, just grinding to learn whatever she needs to learn. And hats off to you. I'm gonna clap because you don't ask for it, but dadgummit, I see it. I'm going through it. So I'm like, whoa, right? So thank you for all you do. And you have really leveled up your business, and it's amazing because people need what you do. So please tell us, Jamie, what you do and how folks can reach out to you and find you, and who do you serve?
Well, I serve the veterans in general, but I'm starting to really narrow down that search because I realize what he's trying to say is the fact that women don't speak out for ourselves. We're really bad at it. Oh God, we're really bad at it. We're really good at helping others and putting on their gas mask before putting on our own gas mask or whatever it's called. Yeah. The bag, serving others. It's innate in us to help our child. Right. So that's where I realized, I mean, I've always been in healthcare and nursing or firefighter or whatever. I was always doing it. Then I got into the military. Then I got into volunteer stuff, and I tried to focus on my medical. And when I realized my medical was controlling my whole life, it kind of started to just kind of fall into place. So it was just an easy transition. It wasn't easy for me to transition as far as my health was concerned. But at the same time, there was a lot of learning that I realized that pretty much most of us veterans needed to do, but nobody's giving us the skill set. And once I realized that they weren't giving us those skills that we needed, even though I had the skills, a lot of us did not get those skills that are needing to be like in place at the gate. Like they're going to teach us to do a bunch of push-ups and sit-ups and jumping jacks or whatever it is we're doing. They need us to give us the skill sets to just take a freaking deep breath once in a while, right? Or to do meditation, to unload the fight or flight feeling that we're getting, the wellness factor of those one to another. So that's where I realized how much mentorship was coming into play. Like I was easily understood how psychiatrists were supposed to be playing a factor in my life, but at the same time, I didn't understand what mentors were going to be doing for me. And I didn't even have that in my vocabulary. So I do now, and I'm trying to transition into the coaching and mentorship role and understanding that for myself, let alone where that's going to go for consulting, and realizing that's where I'm wanting to take that for companies that are trying to help us as far as veterans are concerned. And I realized that that takes us as veterans to build us as companies and individuals. But I understand where you're not going to find 22 years of experience like I have, and transitioning that into companies essentially. You're not going to get that in a university.
I love that.
Real world experience. Right.
Well, you've been through it, and people can go and
we've
check
walked
it out.
in
You've been through it.
Where we've walked in those shoes and really translating that and fully expressing it, like really having an awareness factor that it's just finding those and finding others and getting that to collaborate and really collaborate well. Because there's some that you just kind of have to pilfer through, and then there's some that are, you realize, oh no, you're really good and you understand, and you not only want to understand and you want to work with them, you don't want to work with everybody. So
right, I learned the hard way.
Some you want to kind of filter through, and then some you're just like, no, you're doing good stuff, and those are the ones I want to get together with, and you want to build together, right? Because we've kind of all been through that. But then all of us, some of them just want to tear you down, and that's kind of what especially some of the women, you've really been through it. And when you've been through it, you don't want to repeat those patterns. And so when you realize you're repeating some of those patterns, that's kind of what's creating our health problems. Repeating those patterns. If we want to stay in that, you're going to keep repeating those patterns. You have to really have a really good recognition of saying, this is what's developing our heart problems. This is what's developing our cancers. This is what's developing our mental health. And if you don't recognize those patterns and really start speaking up loud and clear and really understand your medical, then you're going to keep doing the same old thing. So you really have to be having that advocacy for yourself to say, okay, no, I'm not doing that. And have the doctor on your team and be able to speak up and say, doctor, I have this condition, and how are you going to help me? And some of the doctors are,
exactly.
Exactly.
You buy a vow? So I didn't understand that, but yeah.
So Jamie, let me ask a question. What special problems do veterans face when trying to navigate the healthcare system? And what kind of support do you feel that they need, coming from a women's perspective and being that women's veteran advocate?
What problems do they have?
Yeah, can you, if you're able to share, maybe one or
special problems that are like specific to veterans.
That's a loaded question. We don't got that much time, but at the same time, I think most certainly, I think it's starting at transition.
Okay.
That's where I'm really kind of starting to become passionate about, when I realize there's such a large misunderstanding what they're going to be needing going from military life and those skill sets. And know what it is that they're getting information from active duty military instead of really looking to us who have already walked that path and said, this is what you're going to need going into your afterlife or after transition or whatever. And literally, because everybody's path is so different that it's really hard to say this is what you're going to need because everybody's so different. But at the same time, like, you're not gonna be able to tell everybody's situation, but at the same time, you're not putting a plan. Not everybody's putting plans in place, right?
Right.
Like, I do know I had already gone to college and I had already had a lot of college in place. What I did not plan for completely was a medical condition. So coming into 9/11 and, you know, coming into the last year of my enlistment was a medical condition that like took me for a loop, right? So what happened after that and what spiraled after that is a whole nother story. But that's kind of where we go in thinking that this is what's going to happen. This is what's going to come out of it. You know, wars happen, things are happening. Like, we sign up knowing that this is a possibility, but having a pivot and switch kind of a situation, or backup plan to our backup plan for our friends, for our families, and be able to surround us as a community. That's kind of where we really need to make sure that those things are in place. Or how do we have the skill set? Let's say we don't have the capability of using our bodies anymore, but we still have skill sets and management techniques that are in place. And all of us can learn that. We just haven't gotten the skills, and the military most certainly isn't teaching that they're teaching us to be machines, but they're not teaching us those skill sets to be able to manage that stuff in place. So I think that's where really military needs to get us to be a little bit more skill set, just like they are in other things, but transitioning.
Awesome. So Dr. Manley, let me ask a question for you. What are the biggest things stopping people from getting cancer care? And how is your organization, SCHEQ, working on to fix these problems?
Well, there's numerous issues. If I highlight a couple, the biggest ones are often, you know, especially if you're low income, poor, the issue is insurance, underinsurance, or lack of insurance, because that directly impacts if you will go to the hospital, if you can afford to go, and what kind of care you will have delivered to you. Related to that is then, you know, you often have to wait to get a diagnosis because you're afraid to go, because then if you get the diagnosis, then you have to follow up treatments. Then you have to, maybe, do you tell your family? Will you lose your job? Will you keep your job? When will you run out of your benefits? And then if you're the breadwinner, you're stressed and anxious, and often, you know, and then depending on the cancer, there's a lot of stigma, in particular lung cancer. In the 80s, you know, we had great campaigns to stop smoking, but the downside of those campaigns is that they demonize individuals that smoke so badly, and it makes you think that only people with lung cancer have history of smoking, when only maybe 60% might have increased risk. But there's many other lung cancer risk factors that we just don't talk about. But unfortunately, everyone says, "Oh, well, you got lung cancer, you deserved it." But there are patients that don't smoke. There are patients that have radon exposure, environmental exposures, indoor cooking modules, fires, you know, stuff from military, you know, bombs and all this stuff. All that stuff can be damaging. And the other big area, I mean, not the last area, but the big area is health communication. You know, do we have materials that are written in patient-friendly language? Is it reflective of those that are these diverse and underserved populations? Do they see themselves in the materials, on the websites, in the messaging? How is the tone and style? And so together, these things impact how care is treated. And also, if you just look at the workforce, which is sort of a catch-all, but the workforce is not diverse. But when we have a diversifying population, but we don't have providers that even look or have that lived experience, it's much harder then to build that trust, because then the walls are already still up because of all the stuff they've already faced. And some of the stuff that we're starting to do, you know, besides our lung cancer summit, which is really really trying to build up starting to build the resources for underserved patients with lung cancer, is we are starting next year to create a bunch of medical infographics to help break down this complex medical language. And then we're trying to do cancer infographics and a disparity in those cancers to lay the foundational work to then start building up stuff on specific cancers. But if we don't break down the jargon, people can't read my chart. And then they get frustrated and they're like, well, what is this word? And what is this word? So we're not saying that if we create infographics, you'll understand it, but at least you will be able to have seen it before you go in a clinic. And hopefully as we build long-term all this materials, you'll be able to start asking more pointed and direct questions and taking control of your care and not necessarily letting others dictate how you can ask questions about your care.
You're not just educating, you're enabling. You're
And
helping people
empowering.
actually figure. Yeah, that's what's so impressive.
It's
Yeah.
good trouble.
That's right. Get into good trouble. I love it. Jamie, I have a question for you. Let me see where I have it here. There we go. How important is mentoring and their families understand and get through healthcare challenges, especially with cancer or PTSD or mental health?
How important is it for?
Yeah, for having
it's
mentors.
important. I think it's important for anything in your life. It doesn't. I mean, I think it's truly important if you are sick and you're needing to get through a stage in your life. But I think it's important for any facet of your life, just in general, because there's going to be peaks and valleys for life. But I mean, if you're really going through it and you need to get to the other side, if you're having a PTSD crisis and you're needing to really seek out somebody in particular, I think most definitely it's invaluable. I can't even explain to you. I mean, I had therapy for 12 years and I never even really got confronted suicide or had any questions confronting suicidal thoughts.
Wow.
So I had stayed on that hamster wheel for quite some time, but it was internally and never actually got asked. So in the part of like getting through in mentorship, like it wasn't that I was actually getting directly asked about it, but it was the fact that like, how much do you want to actually stay in this? Right? Like, do you want to stay here or do you want to excel? Do you want to stay here? Or do you want to move forward? So there is a complete difference mindset when it comes to actually an awareness that you don't realize that you're doing, that you can do a lot in therapy. It's not that therapy wasn't helpful, because it was actually very helpful at the very beginning of my medical, but it was the fact that like, you can get to the point of your therapy where you start to out-therapize the therapist, like if you've been there long enough, right? So there's stages when you're in medication and your medication and therapy that you just are too medicated. So I think it just depends on who you are and what you are about yourself, that you need to realize where you're at, what's your goal, like, and realize what your goals are. And I do this now where I'm working with somebody and I have them write it out. Like, you need to literally put pen to paper and know what your goals are for the next 6 months. And if you're not even willing to write it pen to paper, which I've had veterans do, they are not willing to do that. You're not willing to do the work. And you and I have had this conversation, because there's some that just don't want to admit it, right? But if you don't want to admit it and you don't want to get healthy, you're not going to. And there's nothing I'm going to be able to do for you as a mentor. It doesn't matter where you're at in life. And if you don't want to get healthy, it doesn't matter if you're sick or not, you're not ready. And I'm not going to be able to do anything for you.
Jamie, real quick, because I want to piggyback off that. We just had Agape, right? She was with confronting domestic violence, and I believe her. She said it took like 800 phone calls and things throughout so long to get the right answer, to get treatment. So do you find that as well for veterans, where they might try a couple of times and then it's like, well, nobody can help me. They give up and it just starts to decrease their mental
You mean
state.
for veterans to find us or for us to find them?
Well, for veterans to find whatever they need, whether it be healthcare, treatment, mental health, job training, and they call these numbers, they plug in, but they're like, we can't help you, or we don't know. And then people just kind of give up easy. I
mean, I think you have both. I think some give up. I mean, I can't even tell you probably how many times I've been told no in general when it comes to the VA system, but I just didn't accept that. Like, I don't like getting told no. But at the same time, I mean, that's kind of where, as a veteran, I just learned to like that part of my personality where it says, well, I'm a fighter, right? Like deep down inside, I've always been a fighter, or I would have never joined the military.
Mhm.
So that there is a part where I kind of played a victim too, right? And I had to accept that as a victim. And this is what the doctors told me, that I'm always going to be sick. And we play into the victim mentality of being disabled, which I am truly disabled, but I'm not a victim. And then when I realized, and I started like giving it a label saying, I'm not going to be your victim and you're not going to take me. But I had to actually put that to action, saying, okay, wait, this is what's happening. I didn't realize it. There is an awareness part. And once I realized there is an awareness, then you got to push back. And once I realized I was pushing back to say, no, this is not happening. And then I'm fighting for my family, because why am I wanting to do this? And once I realized why I wanted this, then I pushed back because I was fighting for me and my family. And I didn't want my child to live without a mother. And once I realized I was fighting for that, then game was over.
All right. So thank you so much for sharing that. I want to have a moment to acknowledge the audience. I mean, we're 41 minutes in and they are still hanging in there. One of the questions was, what alternative treatments are there if you can't afford conventional treatments? That's a great question. I received 7-figure medical bills every 2 weeks. So when we say that there's a cost to treatment, there is such a thing called financial toxicity. But there's also programs out there that are available to you. But what if you're in the middle class like I am? I'm a nurse, so I make a decent salary. So that means for those programs that are for low-income families, to make sure we have equitable access for all, I'm already out of the scope right at the beginning, right out the gate. But there are organizations and foundations that are available to not just give you one payment of your treatment and done. Some treatments are there for 2 long years. In the case of my daughter, it was 10 years that I had to financially take this. And we had wonderful insurance. So there is the HealthWell Foundation. There's also Billing Angel that will help to pay your medical bills if you can't. So if there's a conventional treatment available to you, what I'm saying is encouraging you to stay on it. If it is a thing where it's a financial issue, there are programs. Come find me. Come find Eugene. Come find Mike. We'll get you connected to them. Now, if you have run out of options, which I'm seeing some other questions under chronic inflammation of the body, and truly, they are now, the NIH has actually released a study saying that stress actually can have an influence on your quality of life while being on treatments in cancer and into survivorship while you're dealing with healing and recovering the body. So it is true, it is important to look at your quality of life and find out what those pain points are. If you're dealing with fatigue, if you're feeling with chronic pain, and to really have that frank and earnest conversation with your healthcare provider to say, whatever you're giving me is not working. I need you to help and deal with this so that I can deal with my life and return to what semblance of quality with grace and dignity. So scan the codes. Go ahead, Mike. You have a question.
Well, I want to know, because I'm sitting there hearing that, but I mean, I didn't go to medical school, right?
No.
I don't know what the man's saying. So, I mean, how many people would think, hey, the doctor said that? I mean, who am I to argue? But you're saying you're not arguing. Ask
No.
questions, dive in, dig deeper.
Yep.
Don't assume it. I mean, if somebody said, hey, Mike, you got cancer, dude, you better believe I'm getting second, third, sixth opinions, right? Like, I'm going to go all out. So you're saying, hey, don't feel like you're being rude or you're, whatever. do it. He's
Yes.
not going to be offended, right? Eugene, what do
No.
you think? Weigh in this, Dr. Eugene.
Yeah, because cancer is one of those things that your whole world flips upside down once you have a diagnosis. And typically when you get a diagnosis, you're lucky if you actually have them talk to you to tell you you have a diagnosis, as opposed to send you a text or something in my chart. And then you have 10 other thoughts than anything they are saying. And then they give you this massive booklet, which you're not going to read or understand. And so it's critical to have, those nurse navigators in there that now are billable by CMS. Mm-hmm. But at the same token, there's still not enough navigators for the number of patients we have. Mm-hmm. And so we still don't do a good job of really educating patients about the disease, the options they have. And so that's sort of some of the stuff we're going to working to do to try to create those information and resources and connect them to orgs that may be able to specifically work with them on a specific cancer, because it's how do we make sure people get what they need as opposed to what we think we need to give them, because that's a key difference.
Exactly. Patient focused. Go ahead, Mike.
No, I want you to chime in, but it struck me. This is why we had Jamie here too, because while she's not she doesn't focus just on the healthcare system and better, she's familiar with it, with herself and other people. So I remember this. Jamie, you can weigh in on this too if you like. I remember a bunch of nurses who understand things a lot. They've been in the game for a lot of time. And I was in a chat one day and I'm like, wow, if it's that hard for them to figure out, I can imagine how overwhelming it is for regular people, especially. Exactly. And then you got underserved communities that don't even have half the access. Right. It's a real problem. I'm sitting there going, my gosh, these women know what they're doing. And they're like, what do I do? So Jamie, weigh in on that.
That's kind of why I get so heated now about the fact that I implore veterans to advocate for themselves, right? I'm not expecting you to dissect the anatomy of all things medical and understand all the medical terminology. What I am imploring veterans and military themselves is to understand themselves and to know their bodies. Mm-hmm. So what I get a lot of times, majority of the time, and actually Rochelle can attest to this, is the fact that they're like, oh, well, that's what the doctor told me. I don't know. And when I am asking them about their medical history, I don't know. I haven't really looked at it lately. Okay, well, see, I need you to know. I can guarantee you probably know what's in your lunch. So why don't you know what's in your medical records? So the fact that you're passively passing it off, but you don't know why you got what you got or did what you did, then that's where we're going wrong. We're leaving all of this information about our own body and what's happened to our body to somebody else to dissect. And the fact that you don't know is where they're leaving it to somebody else. You don't have to understand it. What you do need to do is say to the doctor, I didn't understand why I need to have this surgery. Doctor, so-and-so, I need you to make me understand. Why am I feeling this way? And no, they cannot have to explain it to you in the doctor terminology. And if you don't understand, it's your responsibility to get to the point of understanding. They need to sit there and not explain it to you in medical terminology. I have had doctors, because I've had so many surgeries now, I've had doctors literally draw me pictures. Can you explain it to me in doctor terms? And not in doctor terms, but in dummy terms. I need it in my terminology. And if they're snotty with me, I do give it back. Right? I have no problem giving it back. But I've had some really great doctors that are super kind and willing to take the paper that's on the table and take a pen and draw me, I had shoulder surgeries, and draw me a shoulder in a socket and why I'm having to have it breaking apart and here the screws are going to go in, right? I need it broken down so that I'm feeling more confident about the fact that you're the doctor for me. And if you don't know why I need to have this surgery, guess what? I walk right out your room and go find me another doctor. So that's kind of where I need the veteran themselves to ask these questions. If they're not sure why they need to have the surgery, or what has happened to cause this surgery, or what has caused even cancers, or how they can help these cancers, or what they can do to heal their bodies. And if they're not confident with these doctors, then they go find another. I have
Yep.
filtered through so many doctors I can't even count till I know that they're the right doctor for me. I have challenged the VA system. I have gone to Congress to get to the right doctors. So what I'm saying to them is, if it's not the right doctor, go find another one. And if that's not the right hospital, go find another one. I mean, keep going until you know that that's the right doctor for you.
Yep.
And then keep going,
Absolutely.
and keep going until you're healthy, right? There is no stopping you once you're empowered with the information about your body.
Yep. You are entitled to second opinion. And
Right. It is your patient as the right.
It is your
It's
right.
patient's written on there. Yeah. It's a patient's right to like be empowered by your own information.
And it's true. Even sometimes I use jargon in finance, right? But people don't. I talk about chickens to explain investments, right? Like I don't hey, because that's how I understand. I can explain the whole thing in 5 minutes talking about a farm, right? So, and that's what, if you don't understand the doctor, you're not being rude. You need to know it's your care. And I love how Jamie holds people accountable. Well, I'm not sure, because they kind of give up, and you got to kind of jumpstart them and say, no, hey,
you can give up, but you're also going to stay sick.
Exactly.
Right. Like, but I just move on the next one who wants to get better, right? Like I can stay chasing you that wants to stay sick, but also like, I mean, this is not a path. Like I said, it's not taken me 2 years to learn this. It's taken me 20, but you wouldn't either stay being sick for 20 years like I did, or you can learn the shortcut way. Like I don't want to be in college for 20 years. Right. So you can learn from the ones who have taken the really long road like I have. That's why I exist now. Like we didn't have videos. We didn't have ways to like learn from the people to take the shortcut. So
you failed more times than people tried, and that's why they should go to you, right? Like that's my mantra. Well, why should I hire you? Because I failed more times. You want to lose your hairline too? Well, then you better get a guy, an expert.
I'm starting to. Not yet.
Yeah. You got it. See, you want to keep your hair? Then let me teach you how to not fall off.
But see, now I've gotten into communities where I've gotten to nurses who have done that work, and I've gotten to doctors and stuff that like I don't know the medical, but I can get you to the person who probably can, right? Like I do want Rochelle to discuss what she's doing with the veterans and how she's helping them directly, because if I don't work in cancer, I'm not going to try and work them through. I'm going to screw with their mind a little bit, and I'm going to get on their ass, but I'm going to refer. Like I am starting to like really collect the people that I know are doing certain things, and I'm going to directly refer them. I'm not going to send them back to the VA system and let them work it out eventually. Like if it's a VSO and it's a claim, then I am going to make them work the claim. I'm not going to work a claim. But if I say this is the hoops I need you to do before you go work your claim, I'm going to have them jump through some hoops, but I'm also going to send them to the people I know that I've collected that I didn't have in my pocket before.
Awesome.
So, yeah,
absolutely.
There's various.
Love it. So I guess the question for all of us and any one of us.
For you, I want you to actually answer like what you're doing with veterans that we talked about yesterday. Like really, truly, what are you starting to do with veterans with cancer that we had to discuss, like the short, not the 2-hour conversation we had yesterday, but like, what are you doing with veterans with cancers, and you're starting to work with the claims?
Awesome. So I guess this question would be for all of us, and anyone can answer. How can doctors, researchers, and community leaders work together to make healthcare more fair and cancer treatment more successful? And I want to piggyback on some of the questions, and I love the comments. Keep them coming. Keep asking the questions. I want to give a shout out to a few. Dr. New, Dr. Eric Rubenstein, who is an oncologist. Thank you for being here. And we also have Brad, who is here. Thank you so much for coming. And just keep the comments coming, Lisa and Vanessa. And if I haven't gotten to your name, just keep the comments coming. We will answer these questions either here or in the other comments. So, Dr. Eugene, you want to have a stab at this?
Yes. So this one I have seen practically implemented. Oh, if I can remember the cancer, I believe it is either prostate or colorectal. They have brought a consortium together of researchers, patients, community leaders. Some of these are just in the U.S. Some of these span the U.S. and the Caribbean. Some are U.S., Caribbean, and Africa. But they bring together these different stakeholders to understand what the community needs are, not what the community needs, what do they want communicated, and then you work with the community to build the programs that they want. And then the community can go out and then disseminate it to their other community members. And then the community members will come back and probably likely engage more. And then it'll be more likely to enter and enroll in trials and other procedures, because you work to build the trust. But it takes the combination of the clinicians, the researchers, and community groups and individuals. And we often don't do that enough, and we aren't really set up inherently to do it. So you have to really go against the grain of how general medical education is disseminated, but it's the only way to really, really effectively bring up these diverse communities and improve their outcomes and access.
Excellent.
There you go. And real quick, I was in the nonprofit, and I came into the chamber, and I'm not going to go through the whole story. It's funny, but I got to where I was going to give my speech, and I could tell the whole room didn't care. I'll be honest. And so I just said, hey, you know what, blah, blah, blah. And at the end of that, I said, basically, I'm trying to help everybody buy this shit you're trying to sell in this room. When I said that, everybody turned around and paid attention. But the point was, it may not be a business thing or a bottom line issue, or communities are busy, or leaders or organizations are busy, but it is. Once you help out people at this level, when you actually impact your community, it makes a big difference, right? So, it is a problem. It is beneficial for businesses and community leaders to get involved and help people out, right? It's not just good PR, it's good business. So I'm glad that you are bringing people together and tapping into resources and really, helping people out. So am I missing something? Everybody's smiling. I don't know why. Am I missing something? What's going on?
I just
here?
asked her a question, and I'm going to ask it again because I wanted her to re-ask, or I wanted to ask her. I'm just going to ask it again, but I wanted her to talk about the fact that she's helping veterans, specifically veterans, and I wanted her to like let everybody know how she's helping veterans directly, and pretty much how she's helping them specifically on cancer and cancer care.
Awesome.
Go ahead, Rochelle.
Thank you, Jamie. Well,
I don't think she heard me.
I'm the official member of the Veterans Conquer Cancer with ASCO, the American Society of Clinical Oncology. And so we have come together to actually be intentional on helping veterans navigate their cancer care and actually access treatment. Most veteran bases are way out and away from the city. And so just getting access to the care they need and finding those specialty services, they're in rural America. And now they have to transfer off of the base, away from their commanders, and now they need care. So they need assistance to navigate it. And what we have found is there's not enough of us oncology nurse navigators. We are and have been created to provide care for oncology care services for the veteran community as a new entity. We've just been here for about a year in this space, but even with that, we're not available in every single state. So you'll have to go to your regional office and extend your benefits so that you get to 100%. Often, there are certain diagnoses that you have in active duty that don't transfer over into the veteran space, or they categorize it differently. And so we help you to get to 100%, and then I transfer you back to Jamie, and Jamie gets you to 125 so that you can get your community-based care needs taken care of. So this is what we do. We pass between each other. You have benefits to take you off of the base to go into civilian life and get the care that you need, and then come back when it's ready and when it's appropriate to have the care that you need, including travel expenses to other areas if you're in the wrong state. So this is what we do. Happy to do that, happy to serve. And when you think about it, the military is the largest public health organization out there.
Wow, that's impressive. That's amazing. So let me chime in.
Correct me on the percentage, Jamie. I got that wrong. I want to get it right. So go ahead and talk about expanding your benefits above 100%.
So you said I can get them to 125%, and that's not correct. That's not how the percentages work.
Okay.
So it stops at 100, even if you can get them to 100, because not every veteran can get to 100. So you have to be very careful saying that you can guarantee every veteran to 100%.
No,
so we're going to backtrack on the fact that you can guarantee a veteran to 100%, because every veteran's very, very particular on how the veteran can get to 100. It depends on the veteran, and how you have to be meticulous on guaranteeing veterans to 100%. But if you can get to 100, it usually stops out at that. Anything past 100, it's a collection of if you're homebound or in need of aid in attendance. And if you're in need of aid in attendance, you're an SMC rate above 100%. So it means you have a collection of 60% or more of multiple ratings. Or if you have more than 100%, if you have one rating of individually rated at 100%, and you have another rating that's needing aid in attendance, and that's a whole nother basket. But if you look up your SMC rates, then that will show you other rating, but that's a whole nother one.
Yeah.
But it is available for those who are in need and have needing special care for aid in attendance.
Right. And so I'm saying
it doesn't add up like regular math.
It doesn't add up like regular math.
So even I've had 200% and 300% add up, but they still didn't give me above what they were needing. And that's the challenge that I was having with the VA, is the fact that their maths weren't making sense, because I kept getting 100%, but they were stopping me at 100. So yeah, we went into that's when we went into battle.
Yeah. Go ahead, Mike.
First of all, no, this has been an amazing discussion. I ain't gonna lie, I was scared. I said, all these people with acronyms I can't pronounce and stuff I have no clue about. What am I doing up here in the first place? But I know. Oh no, Dr. Eugene's got tons. He's got extra acronyms.
I've got enough I can borrow.
He's Mr. Acronym. He should have won his acronym for Halloween. That's what. But he's got tons of them. But anyway, see, I had to throw me in there. Okay. But seriously, I love this discussion. It's much needed. It's serious. We have fun, but we're learning. And I think this is a great thing. We had great comments from some great people. Eric, thank you for chiming in. Dr. New, she knows what she's talking about as well. Eric, I appreciate you, my friend. Lots of great folks in here. Lots of great discussion. And that's what it's about, right? We're learning from each other. We're moving forward. And I'm just overwhelmed. So I would keep you all here forever, but you would leave anyway, because that's just, nobody's got time for that. So let's start with, I tell you what, start with Dr. Eugene Manley, and let folks know any final thoughts, anything you want to put out there, call to action, and where can folks find you, plug in, and reach out if they want to be a part of the solution.
Yep. Biggest thing is just be willing to ask questions, always advocate, and don't accept no. Just keep pushing and asking and being a pest, because you deserve to get what you're entitled to. If you're trying to find the org, you can find us on Facebook, Instagram, LinkedIn at STEMMCHEQ. I had to spell it out. It was the only way to get them all across the same sites. But SCHEQ is the official website. Our website is SCHEQ.org. You also find information about the Lung Cancer Health Equity Summit on there. If you want to volunteer or find a way to participate or get on our info list, which we're working on grading, there's also links for that on the website. And like I said, just hope you can join us at the Lung Summit. It's going to be a great event. We'll have we have a couple veterans there. We'll have a session on veterans. We'll have the American Indian Cancer Foundation. So we were really covering bases. It's not just Black and Hispanic. It's how are we all collectively making solutions that are improving outcomes for patients navigating lung cancer.
And you were doing a phenomenal job. You're working hard day and night. All right. If I called you at 3 a.m., you'd be working, my friend. So thank you for all you do for all people, but the underserved communities, man. I mean, it's very important, and we applaud your work, my friend. All right. Let's go to Jamie Racebrook, because we've been friends long enough for me to say your name right with an I. Go ahead. Thank you for what you do. Thank you for having this discussion with us today. And I'm super excited to see you just really on a larger scale make a bigger impact for folks. I mean, these folks served and sacrificed for our country. I mean, what could be more important? So thank you for your service and sacrifice. What do you want folks to know, and where can they find you to learn more? And if they need help, reach out to you so you can find help and solution.
Well, it's taken me a while because I was tech illiterate, but I have a website now. It's on there on the QR code, but it's JL Innovative Concepts, and you can find me on there. You can find me on LinkedIn. I'm pretty active on LinkedIn. Instagram, same old places. Instagram is under my name.
Right.
But yeah, anybody can reach out at any point in time if they need anything. And I'm starting to work with nonprofits and companies that are wanting to be veteran friendly. I'm your girl to help you make sure you are supporting veterans, not just using us as tokens, and especially women. I'm finding a real sympathetic, empathetic space for that niche more than just veterans in a whole, because it's been a men's world for quite some time. But I think once the women start to come out of their shells, I think it's going to be a really powerful space that's going to start to really take hold. So yeah, that's where I think I'm starting to become really passionate about just getting them more confident in who they are and what they really need to do. Because once the mothers of the families start to come out and just start taking care of, I mean, they've always been taken care of, but they need to be taking care of themselves. So I think that's where it's at.
I need to connect you with John Kirkhoff. He had just joined the Hounds, and he has that community, Frago 22, and they're actual communities. They have farms, mental health, and they train. His business actually trains companies and veterans so they can plug into civilian life and get good jobs. You two are like cookies and milk. So if I haven't done that already, let's do it, because we need more together. And by the way, I almost started singing "It's a Man's World" when you said that. So I'm glad I didn't. And Eugene was going to leave immediately if I did it. But hey, we have fun here. Yeah, it's a man's world, but we have fun. Hey, we have big people conversations on this show. That's what I like about it. When you got the right people, you can have discussions.
Eugene's trying to be serious, but he's like, it's really hard up in here. It's like,
man, you can't.
But he's like, it's like smile at the stupidity in this room.
Yeah. It's like trying to be serious on the Muppet Babies, right? Like, come on now. I would behave.
We bring it out. You just can't help yourself.
Hey, 50 minutes. All right, I'll pat myself on the back. Jamie,
wait until we go backstage. Okay. It's even worse.
Oh goodness.
So, yeah, I'm kicking. I'm just going to kick everybody out. I'm not going. All right. So, last but not least, Rochelle, Orchid Healthcare, Orchid Care Navigator. Take us home. What's your final thoughts, and where can folks, providers and people who are patients and going through, survivor, what can they do to plug in?
Absolutely. I'm on pretty much most social media, Twitter, Facebook, Instagram, LinkedIn. You'll find me mostly on LinkedIn, but I'm out there. My website is orchidhealthcaresolutions.com. You can join the EHR, where you will find the cancer treatment library using this barcode here and just hitting the register button. If you need to reach me, my email is orchidhcs@gmail.com. That's the short version rather than using my name and the other one. There, you can always reach out to Mike. I'm in the Hounds of Business, and really connect with us, find us. We're here to help you. We're here to help you navigate. If you're a doctor and you find that you have a large veteran community within your group, within your practice, and need additional assistance, we are here to help you stay connected, keep them within your practice, retain them, and help them. So this is where we are. This is what we're doing. And I just want to shout out to a few people. Vanessa, I'm hearing your story and I'm connecting with you today. And Lisa Feverick, really nice to meet you. You're a registered dietitian. Awesome. That's wonderful. And Quentin Taylor Garcia. Well, first of all, you have two names that are familiar to me. One is my husband's name, and the next one is my maiden name. So I just love it. Just really nice to meet you. And I just want to do a special shout out and thank you to all of those in attendance. You hung to the bitter end, and I appreciate you. I hope you have learned something from us. And if you have a question, reach out to us, connect to us, and we are here for you.
Wow. Thank you all. And yeah, Lisa's phenomenal. I actually got somebody I connected her with. And, just put yourself out there. Courage before confidence, dadgummit. People say, well, wouldn't you have the confidence? Are you kidding me? I had the courage to look like a donkey and put a hat on and see what the hell happens. Let myself out there. So all these people here, man, they are the epitome of courage before confidence. Are they not? Come on now. And so listen, if you want to run with winners like this, people who don't take no for an answer, people who go and find a way and make a daggum way when people say there's not a way, I don't know what you're looking for. Hey, come in. All right, test drive us. Right. I don't have an ego in this. I just want to see people make the impact that you could make, just like Jamie's doing, right? Just like Dr. Eugene and Rochelle is doing. Something happened in their life and they said, I'm tired of it. I'm going to do something about it. What are you going to do? Hell if I know, but I'll figure it out, right? That's how we do it. So don't do it alone. Anybody out there, if you're a hound, tell them you're a hound in the comments. You can connect with me on LinkedIn. Also, we have a link on YouTube, Hounds of Business on YouTube. Great video library. And thank you all for supporting. Thank you for what you do for all the people, pushing folks up. Man, I am honored. This was good because I was scared. I said, I can't even pronounce the SCHEQ acronym or nothing, but I made it, and I made it with support from my friends up here. All right. So appreciate. Oh, I'm not dumb. I just know what I don't know. Like I know 3 things well. The rest of the world, I got y'all for. That's what. So I'm a self-aware man. But I appreciate you all, and folks are coming in. Like I said, connect with us and test drive us, man. We want to blow this up. We're going next level, and we're really helping folks in a major way. Cancer Corner will be unveiled, right? The veterans as well. So we've got a lot of sub communities in the Hounds of Business where you can connect with people, right? They can be help, they can introduce you, they can be collaborative partners. Hey, stop doing it alone. All right. So we'll have a great night. I'm gonna let these folks go. They probably gotta go bathroom. See, I got an outhouse. I do my show in the outhouse, so I don't have to worry about it. But y'all fancy people. All right. So well, wave to the people. We will see you on the next one. And my gosh, and we're gonna have a great wellness. It's gonna be a party next week. So tune in, same time, same channel, y'all. Thank you again.
Thank you so
Hounds,
much for joining.
Hey,
Thanks for having us.
my goodness.
Thank you, Michael.
Hounds.
Thank you, Hounds.
Hounds are amazing. Hounds, friends of the Hounds. We'll see you next week, y'all. Thank y'all for stopping by. Be sure to follow, share, and like, and send me a message if you had fun today. Y'all come back now.